Dear madam, it's a great honor to be a guest in Coimbatore. I guess I like this town. I was living only this night and they told me it's very dangerous to live in the center of the town. But I hope that I find a guide to see your wonderful town, which I could see from the taxi. Today I wanted to speak about microbiomics, gut-brain axis and dysbiosis. In Anna, Agni and Basti, you are the specialists, and we have to discuss whether there is a link between microbiomics, gut-brain axis and dysbiosis. And I guarantee to you, if you have understood the revolution of microbiomics, gut-brain axis and dysbiosis, you will have sleepless nights in Coimbatore. You should remember these words: microbiomics, gut-brain axis, bacteria profile, and dysbiosis. And you should consider whether there are connections to Ama, Agni, Vasti, Nashya, and Daya. I remember microbiomics, gut-brain axis, bacteria profile, and dysbiosis. I will speak about Parkinson's disease and multiple sclerosis to make it very practical. As you know, as Ayurveda doctors, Campavata or Parkinson's disease starts in the nose and in the gut. We can observe alpha-synuclein in the colon 15 years before the main symptoms, rigidity, akinesia, and tremor occur. No before, we didn't know that there is a connection between the gut and the central nervous system. But in Ayurveda, it has shown 2,000 years ago. Corresponding to the Ayurveda doctrine, 2,500 years and Domini, nose and gut, that's the colon, play an important role in the development of Campavata. Corresponding to the anatomical research of Bragg and the clinical research of our group, Parkinson's disease starts in the nose and in the gastrointestinal tract. Now, for about 10 years ago, we made the theory that in Parkinson's disease there is a genetic predisposition, that's the blue line, and in addition must come a toxin. We thought that it must be an internal toxin, the toxin must be everywhere, it must be 2,500 years old, and it should be internal. And we thought at this time that would be a bacterial toxin from Escherichia coli. But when I went to my bacteriologist, he started to laugh and said, "You are crazy." All my faculty said, "Dear doctor, you are really very, very crazy," until the last 2 years, when the microbiomic system has developed and has analyzed. What is microbiomic? Microbiomic is the number of all these bacteria in the colon, and you see these are millions and millions of different bacteria. At the moment we believe that we have at least 10,000 species in the colon, and they interact with the brain, and the brain interacts with the bacteria. If you feel that, if you feel your bacteria now in the moment in your colon, do you do it? What are they doing with you? They're doing a lot, and that is the wonder of today. Then we come to the gut-brain axis. That is the gut-brain axis. That means the gut influences your brain by humoral influences of the bacteria, and the brain influences your bacterial world. Then you have to think about, now, what did the Ayurveda teachers tell to you? Yes, Parkinson's disease starts in the colon, starts in the gut. And how could you then think, what is it doing in the brain? With the gut-brain axis, with the microbiome, you can explain this problem. The gastrointestinal microbiome consists of a large bacterial community that resides primarily in the lower gut and lives in a symbiotic relationship with the host, that means with you, with us. Your bacteria live with you. If you like your bacteria, they are friendly with you. If you are unfriendly with your bacteria via the diet, then they are unfriendly with you, and your thinking, your memory has been destroyed. where this axis or microbiome influences brain development and behavior. We can see it in animal experience. Humans coexist in a mutualistic relation with the intestinal system. The lower gut contains 100 trillions. Can you imagine that? Can you count it? 100 trillions of microbes. More than 10,000 different species have been assumed, but at the moment we believe that there are more than 20,000. These microbes are in the gut, are in the skin. Skin is very important of the microbes, and also are in the nose. And therefore you can understand that some diseases now existing in the brain, they start in the nose and start in the gut. The analysis of this system and therapeutic influence is a huge and immense challenge to us, and we are in the beginning. We have not the results, all the results, we have some results. And it's a new, revolutionary way to understand the pathogenesis of diseases and the causal therapies. They influence parts of the brain, like the thalamus, the striatum, the hypothalamus, amygdala, and hippocampus, with their chemical components, which can be toxic, or can you also have a humoral effect. In the animal experiments, bacteria influence anxiety behavior, memory and learning capacity, and also the motoric control in different parts of the brain, as in the striatum, amygdala, and the hypothalamus and the hippocampus. Germ-free animals, that means animals free from bacteria, function. In these animals, the function of the hypothalamus is increased, and this function is normalized by introducing Bifidobacterium longum. That means if you apply a bacterium into these germ-free animals, then the function is changed. Oh, I don't know what is happening with that. Yes. If you have germ-free animals, the explorative behavior, the risk readiness, and the locomotion is changed, and you can influence it by bacterial colonization. Now we come to the term dysbiosis. Dysbiosis is a dysfunction of the bacterial composition. We speak about the so-called bacterial profile. We have certain bacterial profiles in certain diseases. And if you influence this profile, then you can influence the diseases. Different diseases show different specific bacterial profiles. We have some of them. For example, everybody of you thinks that autism is a central nervous system disease. Is anybody against this opinion? Please show that to me. Everybody of you believes that's a central nervous system disease. And many approaches have been done to influence this central nervous disease. But let us look. The gut-brain axis and diseases, they also are looking for autism. Autism has its origin in the gut, in the colon. And if you influence the colon and influence the bacterial profile, then you can improve autism, a disease which you can treat very difficult with any psychotherapy or anything else. The same is with hepatitis encephalopathy. That's a colon disease. Or colitis ulcerosa, that is very simple, and we can treat it with a transplantation of stools. But now, since, I guess, 3 months, the Max Planck Institute has found that also in multiple sclerosis, they can show a typical bacterial profile for this disease. And that is a revolution. If we can influence the bacterial profile in multiple sclerosis, let us say by diet or by VASTI, then by different VASTIs, then we have a causal therapy of this disease. We have still to work in this field for at least 10 up to 15 years, I'm aware of this, but we are at the starting point
now today in 2030, that you should remember that you should co-work with us. You should come and say, let us look for this microbiomics in this case, in this case, in this case, and what type of Ayurvedic treatment should be applied. You can measure it. You can measure the bacterial profile.
What are the procedures? The procedures we are using in our hospital are most diet, in the nose disturbances, nausea, then abhyanga, physical, and svedana for the skin problems, and vasti for the colon problems. The Ayurveda treatment we perform in our hospital is influencing the gut with diet and with different vastis. The diet is very important, and nutrition influences our microbiome in an up to now unimaginable way. We don't know. We have no real opinion how the diet must be. For this reason, we trust the Ayurveda diet, and we hope that we have an improvement, and I show that we have some improvement. The basis is dosha adapted, vegetarian, warm diet 3 times daily. In the Vasti, you are the specialists in Vasti. I would not like to go into detail. We use decoction enema and oil enema for this patient, changing the enemas. Kampravata was detected for about 2,000 years ago, and Parkinson's disease was detected 1817. That means you have a lot more experience in treating Parkinson's disease as we have in our Western world. Kampravata, as I told you, as described in Ayurveda medicine since 2,500 years. Disease starts in the nose and the gastrointestinal tract. Treatment, nausea, diet, and vasti. The swelling is disturbed in 90% of the patients. The pathological findings in amygdala, bulbus olfactorius, and cortex piriformis. I don't like to go in detail with that. I have to short a little bit. That is the nausea treatment. We have, that is also very interesting. Swelling is reduced for about 15 years before rigidity, tremor, and akinesia become visible. That is a very early stage in the disease. Swelling can be tested objectively with a sniffing test, and we have used 2 different nausea methods and measured effectiveness and time dependency. I don't like to go in detail. That is the treatment type number 1, that is with Kshiravara. And you see that we have looked for 4 days and we saw an improvement for about 3 points in the sniffing test. When we have changed the therapy for Brahma and some compounds, then over 4 days the improvement was much bigger, and the difference became much bigger. That was for 3 days, the difference between the first day and the 3rd day. But the best results we got after treatment of 6 days. I know normally they apply 7 days, nausea in Ayurveda, but we have looked for 6 days treatment and wait and follow up to the 10th day. And yes, you see it on this slide. On the 10th day, and you see that is a complete recovery in the smelling of these patients. In these patients, you see also, after the 10th day, it's a full recovery. And what's interesting, nausea improves smelling within 180 minutes. The best results we get after a 6 days treatment, observing the patients for 10 days. The follow-up shows that the effect of 6 days treatment lasts up to 3 years. That means you treat them once and it lasts up to 3 years. That means we have started a healing procedure. Systematic long-term trials with different nausea procedures, I think that's necessary, considering side effects, progression and development of neuropathic cycle disorders are going on. Now we come to multiple sclerosis in short. In urology, the chronic progressive, 10 minutes or 4 minutes, okay. The chronic progressive type of multiple sclerosis is the best and most simple neurological model to study whether complementary medicine works or not. here you see in the brain all these inflammatory focuses. It is white colored, not the ventricles, but all the other ones. These ones, for example, or these ones. You have them also in the spinal cord. You find multiple sclerosis in the nervus opticus, in the brain stem, in the cerebrum, in the cerebellum, and in the spinal cord. And you have to be wise. You have to differentiate between different causes in multiple sclerosis. That's the relapsing cause, that's the first one here. Then the secondary progressive cause and the primary progressive cause. The progressive cause starts in the age of 44 years in all the patients, plus minus 2 years, independent whether we have before that relapsing cause. And this is the best way to study an effect of Ayurveda, because if we can reduce this progression, then it is a real complementary effect, because at the moment we have no treatment available in the allopathic medicine to do this. I want to show it. We have a lot of, you must not remember this, a lot of drugs for relapse reducing drugs, but none of them is able to reduce the chronic progression. The relapse is correlated to inflammatory lesions, but the chronic progression is correlated to a very diffuse degeneration and very diffuse inflammation in the brain. What we are doing in Germany, and I hope that we can also introduce this technique in India, is we inject intrathecally, that means intracerebral fluid, we inject 40 milligrams of triamcinolone for 6 times in follow within 2 weeks. And you can see, and we measure the walking distance, and you can see that the walking distance is improving a lot. It is statistically highly significant. We can measure also with SSAPs, that means somatosensible evoked potentials. And you can see again an improvement after, because if it blue is the improvement, you reduce the velocity of the nerve conduction. Also in the nervus tibialis and this in the nervus medialis. That means we can measure it very exactly. And now I come to the end. We have done a follow-up for about 52 weeks, 52 weeks in a high number of patients. And you can see that we were able to show an improvement in the so-called LSS scale, that is, means is a score, over these 52 weeks. And we could also see an improvement in the starting, and then it becomes equal, but it was fading. It becomes a little bit more or less. Now we have experience. We have experience with addition Ayurveda treatment, the starting point. And you can see over the last 3 years that the people, for about 50% of the people that don't show this decrease, they improve continuously, slowly, very slowly. And that is done, I believe, or the cause of it is the diet and is the fasting. I come to the end. We should remember that microbiomics, gut-brain axis, and bacterial profile measuring and dysbiosis estimation could be a very good possibility to show that Ayurveda treatment is effective. Thank you.